Right, I think in interest of time, we can get started. Um, First of all, good morning, good evening. I think we have folks joining in from different time zones. Really appreciate you joining this exciting panel discussion today. We have uh, two of the leading experts in healthcare who are here with us, who are going to share their exciting experience around some of the things they're doing. I have known both Madhu and Samrat for some time now. They're doing some exceptional work in the area of GenAI and agentic AI. So we're going to start with a quick view on setting the background of what RagaAI is doing briefly, and some of the important topics in this area, and then we'll get into the panel. So let me start with that, and we'll keep that brief. So just briefly talk about RagaAI and what we are doing in this exciting space, and introduce the speaker, and then get right into this. So RagaAI was founded 3.5 years back. We are uh, uh, we are offering a suite of capabilities and platforms to ensure reliability and scaling of multimodal agents. Healthcare and life sciences is a key focus area. We initially started with early 2022 when Gen AI was not a thing. We started focusing on the computer vision part of it, then expanded the same thought process of reliability into Gen AI and agentic AI now. Range of customers using our product today. We are headquartered in Bay Area with a team in Bangalore. Uh, so this is a quick view of our platform. There are three platforms. First is RagaAI Prism, RagaAI Canvas, and then RagaAI Catalyst, which basically enables end-to-end uh, reliability for all kinds of AI, a lot of focus on Gen AI and agentic AI. RagaAI Prism is focused on enabling data quality, which is one of the very important and challenging aspect of reliability of AI. Then RagaAI Canvas is to help build and deploy AI and Gen AI models. And then Catalyst is to ensure basically the responsible AI part, specifically focused on compliance and data security targeted for healthcare and life sciences. I think there's a question there. So what I'm going to request is that please put your questions on the chat box window. Our team will be answering those as it come. We will reserve the last 10 to 15 minutes to answer all these questions in one go. I hope that's okay. So let me start with setting up the context on the challenge of AI and Gen AI in healthcare. I think the biggest challenge that we see when we work with customers across the board is how do we ensure that we are getting the right answer, which is responsible and meeting the aspects of compliance and reliability. Right? I think specifically in healthcare, where basically patient and data safety is of utmost importance, navigating compliance, be it HIPAA, FDA, or GXP standards, is extremely important. I think that's a key focus area of what we do in this panel discussion. Second is how do we protect patient data in all forms, right? And so that with the aspects of Gen AI and agentic AI is becoming even more important. Right? So it's extremely important to look at those aspects, and fundamentally the overall thought process of how do we ensure that there are no hidden risks and the AI and Gen AI applications that we are enabling for healthcare and life sciences are giving the right and responsible answer all the time. And that's where we come in with our responsible AI suite, right? Which offers out of the box compliance enablement for HIPAA, FDA, and other standards, help ensure PII, PHI, and data security, have healthcare and life sciences specific metrics and a feedback loop to ensure what is exactly required for responsible AI aspects, right? Some very important aspects around those outside of compliance and data security is real-time data privacy, which is through Guardrails. Our platform offers audit-ready reports, which are generated as part of the platform, and continuous learning, which ensures that uh, anytime if there is a failure, potential failure, we detect that, learn from that, and ensures that it's fed back into a continuous improvement loop, right? To ensure that it is not repeated the next time. With that, let me just quickly show you a quick video, and then we jump right into the panel. All right. With that, let me introduce our panel speakers. Madhu. Madhu leads. Madhu is here. Thanks, Madhu. Madhu leads the VP Cloud Technology and Product for Deep Health, Deep Health and RadNet, which is one of the largest radiology outpatient company in US. Uh, he is the VP of Cloud Technology and Engineering and where he drives innovation in imaging and AI. With leadership experience at Philips and training from MIT Sloan, he blends technology strategy, product design, and business insights to solve real-world healthcare challenges. He's one of the most amazing and most forward-looking AI leader I've worked with. They are deploying range of agents, and we'll talk more about it. One of the fastest moving company, and he's leading one of the fastest moving AI teams that I've seen across in healthcare. Welcome, Madhu. Really appreciate it.
Thank you, Gaurav.
Then we have Samrat. Samrat Kulkarni is a founder and CEO of Eras Health, leading efforts to use AI and environmental data to prevent hospitalizations. With past role at CVS Health at Bell Labs and degree from NYU Stern and Purdue, he is known for bringing visionary thinking to healthcare innovation. Samrat, thanks a lot and welcome to join the panel.
Sure, happy to be here.
All right. With that, let me just unshare my screen so that we have the focus here. Yes. So let me start with requesting our amazing panelists to briefly talk about their experience in AI and agentic AI, right? And from there, we'll move into the aspects of responsible AI, why it is important and specifically important in healthcare. So I'll request Madhu to talk about his experience, his his experience in Gen AI and agentic AI, and what he's looking to do over the next few years.
Yeah, first of all, thank you, Gaurav, for inviting to this panel and share our thoughts of what we are kind of doing at Deep Health and agentic AI. I think so. You little bit touch upon it. Maybe I will double click and then give a little overview to the audience of the problem statement you're trying to solve, right? And then we go to in terms of why the agentic AI is super powerful way of how we are thinking about solving healthcare problems. Okay, and probably for the audience, you guys already know we are spending we spend billions of dollars in healthcare, and we also know that there is an opportunity to kind of improve how we spend on what we spend on and what are the most important things we spend on. Right now, having said that, at Deep Health, our mission is to further what we call AI-powered informatics, and also advance imaging so that we could make care more accessible to everyone in the planet. That's the vision from our CEO which is the parent company, Dr. Berger, and also from CEO of 𝗥𝗲𝘀𝗽𝗓, which is Case Westra. Now, having said that, at 𝗥𝗲𝘀, we're deeply rooted into radiology. When I say deeply rooted into radiology, I mean every aspect of radiology, right? So we have products, in the space where we can, where people are using top, let's say, 10 of the imaging chain uses our software to run their operations. When they run their operation, they run their business on that, right? It's kind of the EHR for radiology, right? And then a lot of our customers also use our products to actually look at the images and actually report the findings. Typically it is called PACS, enterprise imaging. There are different names to it, but people use a lot of our products to do that. And also, additionally, if you look at our portfolio of products, we are big on what we call population health, because we think proactive healthcare is better, so that we don't spend money downstream on treating it, right? So if you look at our portfolio, we actually do lots of proactive healthcare screening in the area of breast, prostate, lung, and Alzheimer's, and so on and so forth, right? Now let's take a look at these three pillars. The first pillar is in how to run your department well, or operations well, and the second pillar is how can we make radiologists more effective. And third pillar is how can we improve the population health. Three big, like say, thing where we can solve a huge issue in healthcare. Right? In the first one, where you want to run operations, you guys can imagine there is a lot of need for automation. In the past, a lot of automations were led by providing digital tools. Hey, let's provide a workflow so that we could improve it, right? Over time, what has happened is it has turned out into, let's say, operators basically using gazillion tools, to actually solve the problems. Now, for example, let's say you get a phone call from a patient. I would need to know what is the procedure that the patient has to go through. Which location the patient is in, what is his preferred slots available. And based upon what we've seen, what is the right equipment that I need to select? What is the right room that I need to send? What is the right location I need to send for this procedure? Right? There are a lot of things that happen today. Our operators use many tools to basically figure out manually, what is the right thing for them to do in these cases. Now, what if there is an agent which is actually doing all of this just I stated to actually solve the problem, so that the operators are just talking to the patient and then making him more comfortable. Like to a point where, let's say we schedule an appointment, patient shows up, in the let's say the imaging center, right? Now there's so much thing that goes happen in the back, right? The patient needs to be attended. He has to fill the forms. He has to be checked in. Blah blah everything else. What if I know most of it, and then people can provide information as minimally as possible, and then agents could do the rest. It'll actually ease off a lot of the front desk work in actually checking the patient. I mean, I can go on and on, but let's say there is a huge scope of improvement of how we could build agents in actually running operations, from scheduling, from selecting the code, for selecting the right location, for selecting the right time slots. There are many things. So that's kind of the area where we are actually working with partners like Raga in actually accelerating some of the automation that we could build in traditional, what we say, operational AI. That's something what we call it as, right? In clinical side, today when we look at the industry, we feel that we have done a great job in the last decade and a half in providing them a lot of technology, in having radiologists looking at the image and doing it. But in the last 18 months, after ChatGPT, world has changed, completely. Now, people think that there is an art of possible that we could basically, build something phenomenal, which will even increase the efficiency of radiologists. So then we said, hey, will we give them another tool? or will we do something totally different, which will actually, be much more powerful, right, for the radiologists? I think so. I think there is a quote, right, from, publicly available, one of the leading AI companies, where they said people who are worried about building foundation models, are not going to be the, ones who are going to lead the AI in the future. People are going to use the foundation model and build the workflows, are going to be the one who are leading in the AI space. Now, similarly, what we said is in the space of enterprise imaging, or where we are working with radiologists, we said we are going to automate the workflow using AI, not make incremental improvements like everybody else is doing, right? So, and a huge automation opportunity there from a clinical perspective to drive, whether detecting the cancer for the lesion, or like summarizing what the radiologist has found, or automating from scanner to report. It could be many, many parts, but the idea being that you could basically automate the workflow and not just do a small incremental improvement. And in the area of population health, I think so we have published a lot of articles of how we are using a lot of the AI in terms of driving a lot of population health. In fact, one of the case studies what we published is we can actually empower a junior radiologist to be as good as an expert radiologist. That's the power of what AI could do, and we are working on all of these areas in that. So as we continue the discussion, I can add a little more highlight. But these are the different areas we are working on, and this is the problem what we have today.
This is amazing, Madhu. Really, really exciting directions. Thanks for that. And just, I will request Samrat to give just his background. Just one quick question on that is, how many agents you are planning to build next year?
So I think so. At least we're looking at building around 50 to 100 agents next year. In the different areas, and also the ecosystem is exploding. As we see, and what becomes essential is how can we build agents which are more, let's say, consistent, predictable, and we have ability to look at the behavioral change of those agents. Because when you put it in operations, it cannot deviate when we make an incremental or version change. I think so. The industry is evolving to provide us better tools to monitor and to scale and also build stuff.
Yeah.
But I think so. We are at the cusp of how we can make this is all good. But it's an exciting time for sure.
Yeah, that's really amazing to see that you are going to scale significantly in 2026. That's amazing. Samrat, would love to hear your thoughts, right? You bring in some really amazing background from different perspective in healthcare. Would love to hear that.
Yeah, and it's impressive, 50 to 100 agents. So I'll start by just talking about my journey in the data science AI space. Been in the industry for about 15 years, and Gaurav, you've titled this seminar Responsible AI, right? And I'll just say it's easier said than done, extremely hard to do for various reasons, and especially more so in healthcare where the stakes are extremely high. So I spent 15 years at Bell Labs, and I'll just share a story here. Some of you that have been involved with the big data world, this is circa 2012, I believe, where you might recall an incident where a big retail store was able to mine shoppers' data, and they were able to identify a certain teenage shopper was pregnant. So they decided to send a coupon to that teenager's home, essentially, and the dad picked that up, and the dad was extremely angry. Came back to the retailer refused to see them. I don't want to name the retailer, but it's a well-known case. But in this case, turns out that the teenage daughter was hiding her pregnancy from her own family. And then the dad realized that later, and this became one of those gray areas. So I think the issue of trust, I guess there is a lot of data out there. There's a lot we can predict, but just because you can predict something, does that mean you action that where it may violate somebody's trust and personal space? So I think, to me, an element of responsible AI essentially is around privacy and trust. And so some of the issues we're talking about today, I think they've always existed in technology. Whenever new technologies come around, there's also an issue of, in terms of how much you push the limit in terms of what you can do. Just because you can predict somebody is going to die of cancer do you actually do that? And the so what after that becomes important, right? So responsible AI is something I've personally been very interested in, and I'm glad that Gaurav has set up a dedicated team to sort of focus and help us all get through our solutions and use cases. So just to build on my background, after that, spent some time as a CTO of a small healthcare startup. This was in the early days of the 21st Century Cures Act, when there was favorable regulation to open up data silos. And if you're able to essentially connect the dots in terms of a member's sort of clinical history, underlying disease burden, there's a lot of interesting things you can do. And then fast forward after that, sat in CVS Aetna in the clinical analytics team supporting a whole bunch of care management programs. And then more recently, earlier this year, I have launched a startup at the intersection of environmental factors and health. One of the insights based on my experience in the industry here is if you're going deep around understanding, where data, bringing different data, unique data, heterogeneous data sets together can unlock a lot of value, and being able to then use that to help members. In my company's case, essentially what we're doing is, for example, if there's a heat wave, there is an impact in terms of members' risk, and helping a whole bunch of health plans that don't have dedicated teams to do this analytics in-house. My platform is able to do that for them. And more importantly, we're also able to offload clinicians by activating conversational large language models that outreach to members and provide them educational resources. So we went live with a large health plan here in New York. It was very hard to do, given some of the things that we can unpack later on in this conversation, but I'm excited. I'm optimistic. I think the tools are there. Just being able to do that responsibly, maintaining patient trust, those are all key considerations. So yeah, Gaurav, happy to share some more as we move along here in the Zoom.
Yeah, I think we'd love to go deeper into that, Samrat. I know we have in our earlier discussions we had some really good insights, right? I'm sure our attendees are looking forward to some of those. But I think before we proceed, it's time for poll. I think we'll request our attendees to give their opinion, and we will love to hear from them. Yeah, all right, it's here. All right. How confident are you in your current AI system compliance readiness? All right, guys. Let's see. Weak, fully confident, partially confident, not confident, unsure. All right. Can we see the answer? All right. Partially confident. More than 50% are saying that they are partially confident. Actually, no one says fully confident. Oh wow, I think that speaks, that tells, yeah, the story that we are seeing right now. Not confident or unsure, right? So I think that's pretty consistent with what we have seen across customers, right? There's always question mark on how responsible my AI is. Do I have trust? Is it compliant? Right? So let's just start to double click on that. And I think the next question I would request both Madhu and Samrat to chime in on what is their framework of responsibility? How do you look at, as you scale your AI and agentic AI, how do you ensure that you have a responsible AI which is compliant and trustworthy? What's your thought process around those?
So maybe what I'll do is I will add a color to it, and then maybe come to the responsible. I would say how much I can believe in my AI. Maybe if I take the same responsible, the responsible part is a little more. It goes into privacy and all of that. I'll come to that part. But first of all, can we believe in the AI results? Could I use that to drive my business outcome, right? I think so. If you look at the poll, I think so. We are like maybe not sure. Maybe yeah, it's great, but I'm not sure yet, right? It's a right, like it's a perspective from the participants here, right? Now I'll tell you the journey what we took to actually reflect what it is, and of course it's figuring it out. In your case, what is the right way to do it? So let me tell you, our journey, and then it can help with some of you guys who are along the journey. So when we started on the journey, we started with a simple use case. So when like say, we're working with one of the solution, when any patient come into the imaging center, you have a particular procedure you need to do, and we have to select a particular code to map it to the procedure what they come in for, right? So for a particular procedure, there were around 60 to 70 selections that an operator need to make, or maybe more or less, based upon what it is. Now, if you take a look at the total amount of, like, say, volume, what we do, they are in millions, in where we work on. Now, this particular task was, if I have 60 selections from which I need to choose, and based upon, like, say, whether he's a new person or expert person, and especially in this specific particular space of the industry, there's a lot of churn, which means that there is a lot of retraining that happens. So which means that they have, providing 60 options, which means that they will talk to the supervisor. Hey, what do I need to do? And every patient is different, right? There's a different complexity involved in a different information that is available, based upon which they have to make a choice. So this process itself, was becoming laborious, where selecting a particular right, choice. It might feel simple, but by the way, it's a complex affair, at least in the operations part there. So when we started with it, we said we will solve this. Absolutely, we will give them one choice based upon information. But appeared to be that our operators didn't believe it the way our participants said. There's no way in the world, this is going to happen, that the agent will basically select the right one. And initially when we walked the journey, it was the right thing. So then when we took a few steps back and say, do we want to actually absolutely nail down the right like say choice, or do we provide them guidance to do the right choice, right? So that's where I think a lot of these things will come into picture. That, hey, do I make agent will make an action for me, or do I provide the right input so that they can make the right choice? So then we took a couple of steps back and said, we will guide them through the process of making the right choice. And then the operators then, when you allow them to make the right choices, giving them not 60, maybe giving them 5, in which they can, play with it, they believed in a system. And then we are now using that system to learn more of, how do we go to that 90, 95%, 99% eventually. Right? I think so. It is an intersection of what I would say a product design to then agent coming into picture, and also the operator training, which actually then takes that from the maybe yes to then I believe in it. Right? That's the journey what we took. So maybe that's a little helpful and useful. And in terms of responsible AI, we at Deep Health, we made sure that we have all the guardrails that we put in. Where it is in our own tenant, because we use cloud, and we have made sure that those guardrails are all there. And also, because we are a healthcare company, we have certain guardrails put into our system, which makes sure that we are providing the right input. And we do lots of, let's say, studies and all of that before we actually deploy anything there. But that's kind of the journey what we have taken. Can I believe in agents? Yes, but with the intersection of product design, agents, and also operator know-how, and how we are moving forward right now.
That's great, Madhu. And looking at the intersection of the system broadly, right, from design all the way to operator is a very important part, right? Really appreciate that. Samrat, yeah, please, would love to hear your thoughts. First of all, just can you double click a little bit on some of the exciting work you're doing? It's really exciting actually for participants to hear. Yeah.
Yeah, absolutely. So just in terms of, to me, a fairly simple set of guiding principles. First thing, And unfortunately, the media, there is a lot of hype just in terms of what the expectation, that's put on AI. I mean, we can have a debate just in terms of what is the true definition of AI even. But to me, fundamentally, where the technology stands today, by design, these are not thinking machines, right? If you just go under the hood, most experts will say that they do such an amazing job of giving you a convincing answer, and that answer could be extremely incorrect. An expert can pick that up, but the average end user, in this case, the average global citizen that we're trying to serve here with this company, they may not know that. So I think knowing that as a key guiding principle is super important. And then everything that you build after that needs to make sure that as a business, you're essentially being responsible, right? So in terms of the platform that we've built, it is a HIPAA SOC 2 compliant platform. We're talking about healthcare here. HIPAA compliance is key. Love it or hate it, HIPAA has been around since the late 90s. A lot of startup fellow founders that I talk to skirt around the issue, but to me, that is key. I always believe in sort of trust and privacy, right? Those are one of the key rules for HIPAA. And by design, it is very important to adhere to that. So get those basics right. If you look at what happened with Change Healthcare, one of the data breaches that occurred recently, my CISO tells me a lot of that was just basic 101, right? Basic data hygiene. Somebody didn't set up MFA somewhere, and that resulted in billions of dollars of loss for a big company. So being able to adhere to existing standards, that would be key. And again, I'm excited companies like Raga, you provide those things out of the box. So we're able to, as a startup founder, use that and make sure there is no leakage of PHI, PI, things of that nature. So brilliant at the basics. That's a key thing. And then when it comes to the ability of technology, yes, today's generative AI can do much better than previous systems. But to me, the generative sort of general intelligence, right, that is being able to do a broad set of tasks, but those tasks are still inferior to what an intelligent human can do. So there's a little bit of that misguided or misnomer, and most of this is media hype. Just because you're building a system doesn't mean necessarily has to do everything, right? And the other thing I'll say is individual foundation models, they all have their limitations. I have a number of friends and others who just go to ChatGPT, right? They'll test something and they'll say, hey, this gave me this answer. And I know it's not right, but we're really talking about building complex systems, not just one frontier model. So the approach we've taken with my particular use case is one large language model alone cannot do everything. So being able to build a system that you can call it like a mixture of experts models, if you will, right? And this is how humans operate. If you think about it, no human alone has expertise in one area. Very complex decisions are typically made by teams of people, and that's the analogy I like to think of. So think of every time you're building an AI solution, it's a complex system. Humans will have a critical role to play, whether in pre-training, validation, red teaming. That's the approach we have taken. Understand the limitations. And to me, the most important thing is when do you escalate to the human? So the product that I've built, we have carefully designed it to be able to understand when basic education is not enough and when you really need to go above and beyond and start looping in a nurse, care manager to help close some of those gaps in care. So I think it's a complex system, but having said that, there is a lot of investor money. That's the good thing, where startups are being able to innovate, and I'm really excited about some of the future there. But having said that, it is again hard to do. We have to be extremely careful. And I was pretty impressed that the what do you call it, the 800-pound gorilla in the room, OpenAI, just recently said they're no longer going to provide personalized health advice. To me, that is a responsible policy that they've put out there, because you would imagine people just skipping their doctor, skipping their primary care physician, going straight to OpenAI. And I'm glad that this for-profit entity that potentially could make millions of dollars, they continue to do that, put out a clear statement saying, hey, we'll be an educational tool, but we won't give you specific advice about dosages and how do you switch medications, because all of that is licensed, it's regulated, it's there for a reason. And so I also think, policy and regulation needs to play a role. Big for-profit entities at the end of the day have to step up. And that's certainly what I'm building here at ERAS Health as well.
That's great. I think it's time for another poll, and I would request attendees they can just put their questions in chat. We're answering them as we go along. All right. So, which guardrail is the most critical for your team? PII, PHI, model explainability, multiple choices. All right. Continuous compliance reporting, fairness, and bias detection. All right, guys. It's time to get your feedback, and that we will ask our panelists questions around these. Okay, I think we should look at answers. Host, can you show us the answers? All right. Okay, so multiple choice. So PI, PHI, of course, is 65%. Then followed closely by model explainability, fairness, and bias detection, and then continuous compliance reporting. So I think in general, I think looks like obviously PI, PHI is important. We know that, but I think different aspects have their own importance, right, for various use cases. I think that's important. Sounds good. And once again, a reminder for attendees to please put your questions in the chat bot. We are answering them, and we will collect them and ask to the panelists towards the end of the panel discussion. On to the next discussion. So I think specifically for Madhu, right? We get a lot of questions around clinical versus non-clinical flows, right? And Madhu, you are one of the few companies in healthcare which does both of them extensively, right? So how do you see the aspect of trust, responsible AI? How does it differ for clinical, non-clinical flows, for example?
Yeah, I think so. For operational, as long as we provide them with the ability to make the choices, I think so. It was because they are taking action in doing an operational decision, right? Now, when it comes to clinical, this is where the interesting things happen, right? Now, especially in the clinical side, let's take an example of radiology. Okay, in radiology, based upon different practices, whether it's a neurocardio or let's say mammography, the way in which the radiologists look at the images and then report their findings, it could vary by a practice, by organization, and also by a person. Okay. Now, there is nothing like right or wrong. But there are, of course, guidelines, provided by, different entities like ACR and others, where you have certain prescribed guidelines for certain type. But even otherwise, there's a freedom for radiologists to report the findings. Okay. Now, how is that we can basically have, AI learn from those parts and make sure that it is clinically relevant still is a difficult order, by the way. Right. So, in our situation, we had to basically take into consideration all of these things when we do it, so that it is clinically accurate and also, adapted to the needs of these tiers, what we call, organization, a practice, and also a person there. So, and we had to, make sure that we follow a lot of guardrails. It's not that it is actually, diagnosing something, right? Rather, we summarize the information. So there are a lot of things that we had to work on. Our data scientists have to work on to make sure that we summarize the conversation, or not conversation, summarize the findings that they've had to make sure that it's clinically relevant, but still adapted to their own needs, so that they reduce the total number of time that it takes to report against a particular case. That's one. The second one, it is less clinically intensive, but still, let's say you have a certain case that comes in, right? Now you have to assign the case to the right person because which is also critically important for us. Now, how do you select the right person for read the case? It appears to be simple. In maybe call center, whoever has the least load, send it to them. They'll take a look at it. But in radiology, it is highly complex. We need to look at the subspecialty of that. We need to look at what is the load for that particular user, because we don't want to have a person with lower load not getting cases. We have to look at those. We have to look at whether it is a critical case. Then we have to find the right person who is expert in that field. So there are a lot of things that goes on in clinical side. Even simple, when an order comes in for a patient, whom do we route to so that they can read it? It's another specialized field itself. Okay? So now what it comes down to is, AI then now have to look at multiple pieces of information. This is where a lot of these agents comes into picture. They are all working independently, but together to make the right decision so that these things can happen. So from a clinical point of view, building that micro agent so that they can do their job, which is, specialized in doing it, and then coming back with an action so that we can drive towards an outcome becomes an important part of this overall, I'd say, agentic AI building in the clinical side. Of course, in the operational side, it is the same thing, but clinical side, there are a lot of guardrails we need to put in so that it becomes more useful for radiologists to drive towards an outcome.
Makes sense. I think then really appreciate that, right? And I think on similar thought process, right? Samrat would love to hear your thoughts, right? Conversational AI, right, is becoming extremely important everywhere, and specifically in healthcare. You are leveraging conversational AI, right, as one of the core technologies for what you're doing, right? So would love to hear your thoughts about the responsible AI, the trust and privacy when it comes to conversational AI in healthcare.
Yeah, absolutely. And so conversational AI brings a whole bunch of challenges that are very unique just for the nature. Nobody wants to be talking to a machine where you take long pauses, right? You want to be able to understand intent. You want to be able to respond in an intelligent fashion with the right context and the right answer. So in some sense, it is a challenge by definition relative to other sort of web agentic systems or a traditional texting-based chatbot. Now, having said that, the healthcare opportunity is huge because we live in a system where expertise is limited, right? This is the promise of agentic systems in healthcare. True experts, let's say nurse level or certainly primary care AI doctors, which is a lot of steps are trying to get there, right? So that sort of clinical knowledge and interest, that is limited. So in a conversation setting, once you're able to engage with a member, then that is a great opportunity to deliver the message that needs to be delivered. And people are busy, but if you're able to do that deep sort of relationship, it's funny. I tell the story all the time. I spent half of my career at Bell Labs, and voice was big. And towards the end, people were like, "Hey, texting and video is going to be big, right?" And voice is dead pretty much. But if you think about it today, voice is back because tone, what you say, how you say it, those all become important. The other thing we've done is America is a very heterogeneous society. There are people with many different cultural backgrounds and language. Language is a big challenge. Certainly when we launched in New York City, we want to make sure that the conversation happens in the member's language of choice. And AI is very uniquely positioned to do that because if you get this right, you can build a system that is talking in 11 different languages, and it's a lot more efficient and cheaper relative to getting human translators and being able to do that. The other interesting thing about conversational systems are they're consistent. Once you build a system that is designed to represent a certain brand, you'll get the same sort of consistent engagement with a member. You can talk to certainly, for example, in my POC, we had membership that belonged to Medicaid, and Medicaid members most likely they're running multiple jobs. The typical 9 to 5 time frame is not a good time to engage with them. And we had a situation where members would call back in later hours, and you can engage with the member, give them the information that they need. So I think that whole space of conversational LLMs, you're going to see a big inflection. We're already seeing that in call centers, right? And certainly outside of healthcare, there's a whole bunch of use cases. So that technology is going to mature. But having said that, with healthcare, again, given what we've talked about, guardrails, privacy, trust, those are not going to go away. So that has to be layered intelligently and smartly on top of these conversational systems. And then last thing I'll say is I think more generally, though, you're going to have a subset of the population that are just not going to buy into AI for whatever reasons. We've seen this. Again, I bring up self-driving cars, right? How many people die every year? Self-driving cars are supposed to save lives, tens of thousands of lives, but some people just are not going to accept it. And so we realistically have to live in or whatever, let's say you're a startup or you're a company forecasting roadmap, you have to make certain assumptions around usage and uptake of this technology. For me personally, having said that, interestingly, what we found is in healthcare, just because there's such a imbalance between supply and demand, like the pilot that we did this summer, we were very deliberate in calling members who had the highest risk. So, for example, around a heat wave in certain parts of New York City, where we know members that live in what we call neighborhoods with high heat vulnerability indices. So, for example, there's no tree cover. We know a priori they don't have AC, and they are already at high clinical risk and also at high social risk. It makes sense to prioritize those members over others. And what we ended up doing is calling those members, and we got extremely high engagement. There were conversations lasting 20, 30 minutes, because once the high needs member here understands what the technology can do for them, in this case, it was still very educational in nature, but they were engaging with the member. They were asking questions. I know we had a conversation where a member is like, "Oh, I have an AC, but I don't want to set it to 72 degrees because I can't pay the electricity bill. What are my options?" So a whole bunch of nuanced conversations about what they can do to manage their heat risk. A lot of that was delivered very patiently by a well-designed large language model, a combination of, I should say, a mixture of experts model. And that's why we've gotten amazing engagements. On average, the NPS score that this platform received is over 9. And we're talking about members, the agents were able to chat with members who are 90, 100 years old, right? There is a TV set playing in the background. Some of these members had cats. You could hear meows in the background. The technology is very powerful. They were still able to engage with the members, give them the information that we could. And overall, so yeah, I'm very excited on the promise of conversational LLMs. I think people are just going to get used to this. They will, and yeah, there will be a few people that are not going to adopt. Just anecdotally, and we're going to be publishing some stats here pretty soon. There were a handful of people that said, "I don't want to talk to a robot," right? And then the agent is designed to answer that. The agent says, "Okay, thank you. We'll have a human call you back in 4 to 6 hours," or whatever it is. So build a system. I mean, humans are going to be humans. That's what makes us unique and exciting. But let's also build a platform that is equitable for everybody. But just overall, I'm super excited about the promise of this technology.
No, that's great. No, thanks a lot. Very interesting. I think it's time for another poll. I will request our host to put the poll here. All right. Which area do you believe faces the highest AI risk today? Multiple choice. Radiology, drug discovery, pharma, clinical diagnosis, patient data management. All right. Should I add a few more though? All right. Let's see what attendees have to say. Host, do we have the answers? Oh, clinical diagnostic is the highest. Wow. followed by patient data management and radiology, followed by drug discovery and pharma. Okay, I think that might indicate some of the biases we have uh, in the answers as well. All right, so I think I would ask one last questions from the bias. There are a lot of questions coming from the attendees, and our team have been answering, but I'll just quickly pick one or two. But one last question I do want to ask from our panelists is uh, the outlook of Gen AI and agentic AI, right? And of course, we are all of us are very excited about what will happen over the next few years, but would love to hear your thoughts on over the next 3 to 5 years how we are seeing this amazing technology is going to impact healthcare in all possible ways. Would love to hear your thoughts on that. Yeah, Madhu, please.
Yeah, I think so. First of all, there is lots of, like, say, in the market and other places, right? There is a trend going on. There's AI bubble, right? I would certainly feel that AI is going to be there. It is impactful, it is valuable, it has a lot of potential impact positively across the board, and especially in healthcare. Now, of course, there is always going to be a bubble when there is a new idea, because everybody is going to say, "Oh, I can do this all," and then eventually it'll. So I want to say that, hey, AI is going to be there. It is impactful. Yeah, we just have to figure out the right way to use it. Number one. Number two is, the biggest spend percent of GDP. One of them is healthcare, which means that there's, of course, significant opportunity that we have to improve this space for betterment for all of us. How do we spend our, spend, and where do we spend and all. The third thing is, especially if you look at the healthcare. Now, one of the things that we truly believe in, and it's one of our mission, is how do we stage shift a disease? I mean, this concept is so critically important. The reason is important is, especially in the area of cancer. If you move the stage, where you detect the cancer from stage 3 to stage 1, stage 4 to stage 3, your treatment plans are you'll have many options. You'll have better quality of care. You have to and you can treat them, or even probably you can overcome the entire cancer and live in happy, healthy life, right? So it is critically important. How do we stage shift it? I would say the role of AI is becoming more prominent. If how we can allow this to happen and how we can make this happen in this space. I see, and also, like, if you look at a lot of our studies, what we have published, and also, and that's the journey we are in, and we think AI is a huge, super good tool. And of course, there is lots of complications in that, in how we reduce the bias, how we do the rights cases, how do we court the cases to train the AI, and all of course they're all there, Guardrails and everything else is there. But I see that this is going to have really positive impact, both on how we spend, what do we spend on, and how do we live our life. I think this is going to be dominant force for healthcare, especially in the next years to come.
Definitely looking forward to that. Samrat?
Yeah, absolutely. So I agree with everything Madhu is saying. I'm very optimistic. Certainly, actually, if there is anecdotally, you would have seen healthcare. I think is one of the industries that has adopted these newer technologies the fastest in the past couple of years relative to other industries. So certainly, I like the attention this is getting, and selfishly, as a startup founder, want to ride that tailwind. The other thing I'll say is, if you look at, I've lived through various technological sort of transformations. I think we're actually going to pause here for a little bit, just in terms of the maturity of the current technology. Because if you think about certainly using OpenAI as a yardstick, right, the GPT evolutions, GPT-5, where we're today, to me tells me that they've done enough amount of training using sort of traditional methods. Yes, there are a few startups like TML, SSI, Jan LeCun's new venture that will potentially try and disrupt that. But to me, that is actually a good thing, because what that means is businesses like startups like ourselves, yourselves, and other healthcare institutions, they can actually leverage the mature technology that's out there and build solutions and products around that. Because one of the challenges, if your technology is changing very, very rapidly, then it's hard to keep up as well. But I feel like this is a good time if anybody wants to launch their own startup or even traditional healthcare companies want to innovate and build mature products. Now is actually a good time because the technology has reached a point where I feel like we can control it better. There are certainly companies like Raga, I'm going to keep plugging you, being able to have a centralized place for us to be compliant. Let's go and build to solve interesting use cases. Now is the time to do it. And rather than just getting caught up in the hype curve. So yeah, in the next 3 to 5 years, I see there will be more embedding of this within the healthcare systems. There are a lot of structural challenges being able to orchestrate these legacy systems. I do think it's a good time for us.
That's great. I think we're at the top of the hour. There are a lot of questions. Actually, I'm just thinking, should we, if Madhu and Samrat, if you have a few more minutes, can we take a couple
Sure.
of questions? Yeah, is that okay?
Yeah, so Gaurav, I have a important meeting that I need to go to at the top of the hour, but I'll be more than happy to answer offline. Like you can send it to me, and then we can
Sure.
relay back to the participant. But I really enjoyed the discussion. Again, thank you for Gaurav inviting us to
Thank,
kind of share our thoughts and what we're doing in healthcare. I'll be more than happy to share in the future.
Thanks a lot, Madhu. Really appreciate your time. Really appreciate it. Uh,
Thank.
thanks a lot. I will just ask one question here for Samrat. Yeah.
Sure.
So, Samrat, the question is, what kind of solution your team was able to offer to these individuals that were at the risk of suffering from heat wave?
Yeah, absolutely. So there are a lot of educational resources. So one of the things, the interesting thing about extreme heat is depending on where you are in terms of your age, your comorbidities, what medications you're on, it impacts your body's ability to thermoregulate. So your risk level can change significantly year over year. So let's say last year you were fine when it got hot. This year you may have picked up a new acute condition, a chronic condition, and you may be on new set of drugs. So just being able to do an assessment and care manage, as they call it, that member, that is always a good starting point. And then beyond that, what happens is there is information that is scattered all over that doesn't necessarily get packaged and delivered to a member in a consistent way. So, for example, we there's a whole bunch of cooling centers and things of that nature that the New York City Department of Health has, and the average member doesn't have that information. So, being able to package all that in an intelligent, succinct manner and being able to deliver that to end user was very powerful. And that's where we saw some really strong engagements and also some strong metrics around cost reduction.
That's great. Yeah. I think there's another question to your earlier comment on ChatGPT not giving personal advice, right?
Mhm.
Are regulation the only guardrails to what AI should not do on that point?
Yeah, so regulation is certainly, we have to meet the regulation, right? Otherwise, you're just going to get fined and go out of business. So that is a given. But then I think after that, it's really the trust and your values and your brand. Who are you as a company and what is the brand that you're building? So I bring up that retailer example, right? So there is a certain loss in trust. So to me, I think that's where there are companies that are very deliberate and explicit about showcasing their use of AI. And certainly there are various frameworks, right? There's a model card that Chai has put out, and Gaurav, your company offers a lot of those frameworks. So I think trust is key because that ties into brand, and we know loyalty and satisfaction have an impact on how you do as a company. So it's got to go beyond regulation, but regulation is sort of table stakes for sure.
Yeah, completely agree. Right? Yeah, that's an amazing viewpoint on this question. I think there was one more question. I think you answered that. Yeah, I think we're at top of the hour, so we'd love to wrap this up. Would love to really appreciate our panelist, Madhu has to drop in Samrat, to join this, give their exciting views on this important topic. Samrat, if you're okay, we can ask our panelists, our attendees to send offline questions to you, if that's okay. Madhu has agreed for that.
Yeah, absolutely.
Yeah. Yeah, guys, thanks a lot. And our next session is on 4th December in Boston. It's a live session. If you're in the area, please attend that. We are going to amazing list of speakers there. And we keep doing these webinars every other month. So look out for our next webinar. And this recording will be available, sent to everyone. If you have any questions, any feedback, please reach out to us. Once again, thanks a lot, Samrat and Madhu. Look forward to the next webinar on this. Thank you. Thanks for all the attendees. Thank you.
Absolutely.
Thank
Bye.
you. Have a good day. Bye.